We pretty much already know that pacifier usage is not ideal and not the best, especially when it comes to oral development as well as dental development. But did you know that preemie babies actually do benefit from pacifier usage, especially in the hospital? If you'd like to know, go ahead and continue watching this video. Hello my beautiful ladies, I'm Adriana. I'm a pediatric occupational therapist and neonatal therapist. I specialize in feeding and lactation. So today we're actually going to be talking about the different benefits of pacifier usage, and I'll be talking about 4 different things that we do in the hospital for our little ones. Before I dig into this information, go ahead and hit the subscribe button and also the bell notification so you guys know when I'm actually going to post up more videos. So as a neonatal therapist, one of the main things that we utilize pacifiers for, it maintains the suck reflex. So basically your preemie babies are not in utero for a long period of time, and that means that they're not really practicing their sucking skills, because normally they're always sucking on their fingers, and they're also practicing their swallowing skills when they're inside the uterus. But what happens when they're outside of the uterus and they're 28 weeks, 23 weeks, we have little ones 30, 32 weekers that don't really practice for a long period of time, right? So normally pacifier usage is one of the main things that we actually do utilize in therapy and when we're actually seeing them, in order to continue to practice that suck reflex and also that swallowing reflex, for them to be able to practice those skills and strengthen those muscles that they don't have the opportunity to do so in utero. Now there's also research studies that do mention that pacifier usage actually does help with having them actually transition to the bottle a lot quicker and a lot faster. Per research, they could be discharged 5 days earlier. Now the second benefit that we're actually noticing, and obviously there's so many research studies as well, is it helps with really painful procedures for the preemie babies, but also for older kiddos that get surgeries, and that actually increases oxytocin levels and it decreases the stress hormones in the brain, which does help rewire the brain into a more positive experience rather than negative one. Now the third thing that is actually really beneficial to utilize the pacifier is it actually helps them digest a little better their food while they're gavage feeding. So gavage feeding again is when they're feeding through the tube through the nose or through the mouth, because they're not usually mature enough to be able to suck down a bottle or to be able to suck on a bottle, period. So it's ideal for them to actually suck on the pacifier, which brings down the food, or I should say more so the milk, and it helps them digest a little bit better. So therefore it increases the weight. It's really beneficial for little ones to be able to bring down that reflux, which is one of the main things that usually occurs with preemie babies. And the last thing that actually is really beneficial for all babies in general, even full-term babies that go home, if they do have the pacifier or like the pacifier under the age of 1 per the American Academy of Pediatrics, it's really good because it actually decreases sudden infant death syndrome. But ideally, if you could wean away the pacifier before 6 months, that would be ideal. Now, these are a couple of good benefits for pacifier usage, and that's for you guys to consider. Thanks for watching this video and hope you like it. Please share and also subscribe to my channel. Thanks very much.